medical experts are calling for proper health information awareness and literacy campaign by the Nigerian authorities as a way to check the spread of the novel coronavirus.
The advice is coming as the Lagos state and the federal governments are urging Nigerians not to panic as there are adequate measures in place to check the disease. But the experts want more honest and openness on the part of the authorities on the reality of the Nigerian health sector by effectively taking charge of the communication channels to avoid more transmissions of the virus.
Well, the Rise correspondent has a report on this.
Lagos. 39 persons quarantined in Ogun, some more in Plateau State. No one knows how many more are at risk in other parts of the country as the authorities track more contacts. That's the reality of the novel coronavirus in Nigeria, Africa's most populous country. Since the discovery was made public early Friday morning, the worry, or if you like, panic button, has been put in an active mode. It is Nigeria after all. No one is sure, and the capacity of the authorities to effectively contain the virus is a big issue for many.
The people that have been trained to handle matters that are on the ground to do it, and that we're doing everything to ensure that if anything happens, you've seen all sorts of person-to-person and incident commanders and people that will go around ensuring that we can locate suspects or contacts. That's the word.
We cannot trace all the contacts. Let's be factual here. Now, what we're seeing is we've seen an Italian. We don't know, we don't understand the depths of how this thing has gone to. So, I mean, what government ought to have done, or what they should be doing, is to honestly strengthen that public discourse, public information, proper information being disseminated to the people on the things that they need to do, on precaution they need to take, and how to even limit some specific actions and gatherings that can promote the spread of those virus, okay?
The rumor was rife a day after that the patient being observed at the Yaba facility made an attempt to escape because of the status of the center. The authorities dismissed the report, but admitted that he has indeed been moved to a better place.
What we've been doing, and for practitioners like yourselves to also come around this facility and see for themselves, what all of you are doing.
Here is Governor Babajide Sanwo-Olu and his deputy appearing in the protective suit for medical workers responding to the emergency while on a visit to the center on Sunday. How many of the kits are available in reality to the doctors and others, the authorities have not stated.
Sincerity, honesty, truth in public health is so essential. It's far, far more important than hope. It's far more important than photo ops. It's far more important than make-believe. Because the challenge is this. Once you are not being sincere, once you are not telling us the weakness and the challenges you are having, okay, what you do is that you are going to compromise the thorough response necessary, to beat down epidemic and diseases.
Well, joining us now is Doctor Emmanuel Soyoola, well known for his excellence in obstetrics and gynecology. Thank you so much, Dr. Soyoola, for joining us this morning. Let me begin by asking, because we're talking about the patient's care here. However, these patients do need to encounter a doctor before they get those care we'll talk about. Yes. And it could be any doctor, yes. Usually general practitioners. As a medical doctor practicing in Lagos, where Nigeria has now had its index case, are you reassured? Are you confident with the response we've had so far?
Well, I cannot talk about the response so far, but there are things we can do as a community, as an individual. The response to any outbreak is, one, the universal precaution. One, learn to wash your hand thoroughly. You spend 30 seconds to wash your hand, and then with soap. And if you don't have soap, where you have disinfectant that's at least 60% of alcohol in it, use it to wipe your hand before communicating with people. If you have cold or you are sneezing, you are coughing, use tissue. Don't use your hand to cover your mouth. The tissue should be disposed in a trash can that is covered. And that would prevent you transferring it to people. And if you are sick, stay away from the big crowd, because this virus is a droplet transfer process. And if you don't get the droplet, you are safe. And if you have traveled to an area where it started from, or from areas where it's been discovered, try to at least notify your provider or any healthcare that you come in contact have had a recent travel. Staying away for 2 weeks, according to the CDC, will help you to quarantine the person. So where we can get quarantine, but if you have fever, notify them. There is no treatment for the virus yet.
Okay, so what's going to be the regime of patient care? What is it going to be like? You know, because we remember during other attacks like that, I mean, Ebola, fluids and the likes. I mean, is it multivitamins? What do you think they might be giving the Italian man there in the hospital now? Is it drips? I mean, what is it? What's the big regime of care to help his immune system fight this, since we don't have a vaccine for it?
Because if it's a viral infection, we know we can't treat it. Give antibiotics. If you have pneumonia, try to treat for secondary infection from bacteria. Even if it's a viral pneumonia, if you can treat the viral the secondary infection because of the bacteria, that will help. And giving fluid to replace the fluid volume, maintaining the circulation, that will help the patient. Because once the symptoms are being addressed, eventually the patient will develop immunity against the virus.
I mean, we do know that coronavirus or COVID-19 does come from a large family of viruses that transitions from a common cold to more severe respiratory cases. Are there any other signs to look out for, things that may have slipped under the cracks? And we know, like you've mentioned, fever. Some have said sneezing, like a spike in your temperature. Are there any other signs to look out for?
Difficulty breathing. Those are things you have to look out for. You have fever, you have coughing, sneezing, and difficulty breathing. Once you get to that stage, report so that at least people can isolate you. And don't go to the big crowd. If you have to go to your church, tell them, make sure you are sick. You can stay away from church, or you can stay away from mosque, or you can stay away from a big gathering. If your child is sick, make sure he stays at home. At least that will prevent the spreading of the disease.
I mean, because that's really very important. There was a case of a South Korean pastor that afterwards was coming out to apologize because he insisted that his members must still attend, his church, and that was where the spread started from. So
most cases are linked to religious houses in South Korea. But let me ask you,
because what would you say about that?
The World Health Organization, did carry out a survey, 44,000 infected patients. And according to them, from that data, 81% develop mild symptoms, 14% develop severe symptoms, and 5% become critically ill. So explain, how is it that most people who come down with coronavirus would only have mild symptoms? And those symptoms, are they not likely to be mistaken for common cold and flu?
Yes, they are likely, because we have not got a pattern for it yet. When a new disease comes up, we have to find a pattern. Not every disease will become severe. Even the ones that we are dealing with now, you have the less severe, which is the mild symptom, then it goes to severe, it becomes critical. So you have to treat the severe one and the critical one. The mild symptom, we may not know. Some of them may eventually, you develop immunity to it and you get over it. Now, for example, when the flu comes, not everybody die of flu. Not everybody comes down with pneumonia, but some people still get it and they get over it. The same thing with coronavirus. And that means you have the mild, you have the severe, you have the critical ones. The critical ones and the severe one needs to be treated immediately and put in isolation to prevent the spreading. Because this type of virus is not only limited to where it came from, it's also becoming worldwide. That means it's becoming pandemic.
Okay, I just wanted you to speak to what I asked earlier on about, education of religious bodies, the religious role in things like this, in case somebody gets sick. And I'll also add this to it. If you see it's circulating on the internet, a certain pastor from Ghana says he's got a coronavirus oil.
He almost speechless.
No, yeah, it's on the internet. And people are buying it. He's selling one bottle $40.
Okay. One thing is that there is no cure for coronavirus. If CDC have not got a vaccine, there is no cure for it. That's number one. Now, about religious gathering, it doesn't have to be. It can be mosques, it can be churches, it can be schools, it can be
Parties.
Parties. It can also be daycare. If you are sick, your child has anything that looks like flu-like symptoms, just like a common cold, stay away from the big gathering. At least so that you can get over that, you will not spread it to other people. Because in the process of hugging you, say good morning, good, and you know the way we greet here, we
Very affectionate.
Yes, because of that, that may spread the virus. So if we can do universal precaution, and if you know you are coughing, put on a mask. There are masks. It's
a
not,
lot of people are saying about the mask that
I was going to speak
it's not even healthy, that it might even get you infected, that there's no craze about the mask. That's what epidemiologists are saying, even here and in America.
Okay, the reason why the mask is elite, at least it prevents the droplet. Yeah. It prevents the spread of the droplet. If the droplet is, if you are sneezing and it's into your mask, it's you and yourself. Nobody else, but if I sneeze in the public, everybody else is getting it.
I mean, you have spoken about mild symptoms, and I want to speak to that, especially regarding airports and airport security and screenings. We're going on a break, and when we come back, we'll continue this conversation. Welcome back to the morning show here on Arise News. We're still joined by Dr. Emmanuel Soyoola, well known for his excellence in obstetrics and gynecology. Now, before the break, I was talking about, I mean, you mentioned mild symptoms, Adisu. A lot of people, a higher percentage of people do experience mild symptoms when they have the coronavirus. Now, looking at our airports, because that's where most of these maybe patients would come in from, do you think that there should be a total ban on countries that have been recognized to have these coronavirus? Or how do we tell if someone is not showing and they walk through security without a fever, a spike, or whatsoever?
What they need to do at the airport is to do the same measures they did during Ebola. Every person that comes from all over the world, especially from African countries, they take your temperature, they take a swab of your hand, and they run it through the detectors. And if those are negative, at least you are 99% safe. We have to do that. Even Nigeria can do that. We can afford that. It won't cost us but little or nothing. That is the first measure. The second measure is to make sure that when you pick up a patient with fever, they just need a sensor. Put the sensor on there, it will show their temperature. Even if they are just coming from the plane, you can easily take it from the ice cold plane, it will still show if they have fever. Because your body temperature will not change that rapidly. So you can pick that up. All they need to do, passenger deplaning, just go there. They have a sensor. You know them. They just sensor them. Everybody has to, whether they are high or low, no matter their class. Private plane, you do the same thing. You treat people the same way. Then you avoid them having, if you see anything that is a fever-related, separate those out. Isolate them. Go further to find out what they are going through so that you can investigate it. Because if we do country isolation, we're going to have the same problem. Like now, you have a phobia for Chinese people going to America. The phobia, because everybody will say is because it started in China. But not everybody that goes to China are going to get Ebola. You understand what I'm saying? The same way they have a phobia for Africans coming from Africa during Ebola. They believe everybody has Ebola. And it took a while before we can get over that. So you don't want to create that kind of fear in the society.
Okay.
Indeed, and you know, rightfully as you said, a lot of people thought it was going to be a Chinese that we import the case to Nigeria, but here we are. It was an Italian. But let's talk about those susceptible to this. We've heard of those who are aged, those who have pre-existing medical conditions. But let me talk about your field. Have we heard about pregnant women? Are they more susceptible to this?
There are some classes of pregnant women that will be more susceptible to this. Pregnant women that have diabetes, pregnant women that have other complications during their pregnancy, they are more susceptible to it. Pregnant women with SLE-related or immune disorder-related, they are more prone to that. Because once you are immune compromised, you are more prone to that. People that have HIV are more prone to that. People that have other infectious disease are more prone to that. So those are the people that you're going to look at.
How about children? There was a case of a child recently. How about children?
Okay. Children generally, they are less prone unless they are below a certain age.
Okay. What
like if they are below 2, you are more critical. 3 and 2 and above, they are more resilient. But any child that have cold symptoms, they need to be evaluated because children will not tell you because they are very active. For a child to say they are down, they have gone through a lot for them to be down. So you have to watch a change in their performance, a change in their
behavior,
activity, a change in their behavior. Parents should take note of that. Don't wait till the time they say, I can't do it. A child to say you can't do it, they already lost 60 to 80% of what is required.
Okay, let's start. Sorry, Annie, you wanted to come in here.
I mean, I'd really like to talk about the spike in pricing when it comes to face masks and hand sanitizers. We are seeing an uprise in how much these things cost. And you, as a medical professional, I'm sure that you need these masks and these hand sanitizers to function. Has that affected you personally? And also, what would you say to those that are taking up the prices just because they know that there's a huge demand for it right now?
That is Nigeria. Unfortunately, the mask that we need in our hospital for the next 5 years, we have them.
Thank goodness.
So even if we have an outbreak, we still have enough masks.
Okay.
So we're not going to buy a mask because of the present condition. Okay. We have prepared ahead, so we have more than enough masks, not because of the outbreak.
Okay. And just to say, you wouldn't even be treating a case if there's an outbreak. You'll be taking it to the Center for Infectious Disease, yes. So it would not even need to come to your hospital in the first place. So this morning, the DG of NAFDAC, who is also a professor that has done a lot of extensive research on viruses and the likes, was on television and was saying about some studies that have been done so far. There's been a story circulating on the internet about chloroquine working effectively against this. And she confirmed it. I said, although Sonia confirmed there are studies as regards, the use of chloroquine and coronavirus. I mean, what do you say about all these studies that are going out there? There's also the study that comes out of Israel that said for avian coronavirus, they found this, they found that. And most importantly, Professor Maurice Iwu came out yesterday with a press statement to that effect. That, I might have gotten a cure to this and all of that. I mean, they should give us a chance. And that's a professor of pharmacology. What do you see to all of this happening?
I don't know about what they have done, so I don't want to be skeptical about it. But if they have actually found a cure, they are welcome to communicate with CDC. They will be more than glad. CDC has an open arm. They want you to develop a vaccine. I don't know how chloroquine is going to take care of the vaccine for coronavirus. It's just like saying you have chloroquine to take care of flu. I don't know. I hate to be wrong, and I hate to say I'm right. But with the little knowledge I know about science, I had PhD in molecular genetics. Not just the little knowledge I know about viruses, replication, and treatment is not the way we are thinking.
Okay.
So I want us to to be a little bit drawback to say before you jump and say you have a cure. Because viruses, most of the time, you're either going to develop a vaccine against it to treat it, or you can treat the symptoms. The symptoms are because of you are treating the secondary infection. You are giving them fluid that they are losing because of what they are going through. You are stabilizing their cardiovascular system to help them. Eventually, their body develops immunity against it. So it's just like saying somebody say he has a cure for AIDS, HIV, HIV. HIV, you can lower the viral load. You cannot say you have cured the patient. You can make the viral load to be undetectable, but immediately they stop taking the medication, they will double. I have seen it. I have patients that come to us, their viral load is unsurmountable, but if you start the triple medication, before their delivery, it's undetectable. That is where it works. But if that patient stops taking that medication, they are back to square one. You understand what I'm saying? Yeah. So it's just like somebody say, oh, yeah, I've been cured because I've taken my medication. And the very day you stop, the virus say, okay, we have a room to multiply. The thing inhibiting their multiplication is now out of the way.
Became resistant to chloroquine in the first place as a country many years ago in the treatment of malaria. We're supposed to have Dr. Onigbide talk about the myths and the facts of coronavirus. Maybe perhaps we'll just start with you since Rufai has started by asking if anti-malaria can cure coronavirus. Let's talk about
chloroquine is not only an anti-malaria, it works for lupus too, an anti-immune disease too.
And some other...
Yeah, and some other diseases. So it's not only an anti-malaria, it works for lupus, which is an anti-immune disease.
An anti-malaria. Yeah. But what's the distinction between aerosol and droplets and airborne, and which is the correct transmission for coronavirus? Because they say it's not airborne, but if I do sneeze and these droplets are in the air, isn't that aerosol transmission? Okay. Can you clarify that for us?
What they mean by not airborne is that, let's say now, if it's airborne, if you have it, if you breathe here, every one of us will get it.
Okay.
That means you don't have to dispense it. Even your voicing, it will come out. It's a virus. But if it's droplet, that means you have to deposit it somewhere for you to get it.
Okay. And how long do these droplets, I mean, because we are aware that that's how it's transmitted, how long do these droplets stay outside the body, like if it lands on its surface?
That's why. If you clean the surface constantly, within 30 seconds, they are wiped out.
Okay. And
30 seconds? Yes. But if you do
that's
not
why
wipe them...
if you wash your hand, for example, let's say somebody sneezes on me, and I wash this hand for 30 seconds. Okay. Most of it is gone.
So for if something that is not cleaned, how long does it stay outside of that?
That we don't know. We don't know. That test has to be done in a bench lab. That we don't know. Somebody is saying that there's a number, but they have said that if you use it's at least 60% handheld sanitizer that has 60% of alcohol in it, it makes them inactive.
Okay. Well, we have to thank you very much, Dr. Soyoola, for coming on the show this morning to educate us some more on coronavirus. We do appreciate you.